Thanks for joining us for this session of the North Central Farm and Ranch Stress Assistance Center webinar series. It's presented to you by the National AgrAbility Project, and my name's Paul Jones. I manage the National AgrAbility Project, which is headquartered at Purdue University. Our topic today is farm stress resources across the USDA Farm and Ranch Stress Assistance Network, which is commonly known as FRSAN. We have representatives from each of the four FRSAN centers today. We have Casey Hulshoff from North Central Farm and Ranch Stress Assistance Center, Susan Jakes from FRSAN South Farm and Ranch Stress Assistance Network, Laura Del Pret from Vamos, which is formerly known as FRSAN Northeast, and Don McMorran and Maddie Vanderkoy from the Western Regional Agricultural Stress Assistance Partnership. Some of you may not be familiar with the USDA NIFA Farm and Ranch Stress Assistance Network. It was first authorized through the 2008 Farm Bill, and the goal was to establish a nationwide farm and ranch stress assistance network that provides stress assistance programs to individuals who are engaged in farming, ranching, and other agriculture-related occupations on a regional basis. And again, there are four regions. We have representatives from all of those today. And if you'd like basic contact information about all those regions, you can go to agrability.info/FRSAN. Again, that's agrability.info/FRSAN. And some of you may not be familiar with AgrAbility. We are also sponsored by the USDA National Institute of Food and Agriculture. Our main purpose is to help essentially anyone in agriculture that has virtually any type of disability. Currently, there are 21 state AgrAbility projects around the country, and each of those is a partnership between a land-grant university and at least one nonprofit disability services organization. Again, one national AgrAbility project, and that's through Purdue's Breaking New Ground Resource Center. And our partners on that grant include Goodwill of the Finger Lakes and Washington State University. If you'd like more information about AgrAbility, you can go to agrability.org. We also have approximately 180 archived webinars that you can review at your convenience, including those about farm stress. We do appreciate support from USDA's National Institute of Food and Agriculture, and we acknowledge that here with our grant numbers. Because of the number of presenters we have today, I'm not going to do a formal introduction of each of them. I will remind you of what we indicated on our announcement, that each of the representatives from the four regional network centers will be highlighting key professional services and support available to agricultural producers, farm families, agricultural workers, agricultural service providers in their regions. And the presenters will also share information about important partner organizations and other regional resources that help to complement FRSAN's work. So our order of presenters today, first we're going to start with Don McMorran and Maddie Vanderkoy from Western FRSAN, then Laura Del Pret from Vamos, Susan Jakes from FRSAN South, and then Casey Hulshoff from North Central FRSAN. So at this point, I'm going to stop sharing my screen and turn things over to Don and Maddie.
Thanks so much, Paul. Maddie, are you able to load our presentation?
Oh yeah, give me just a few seconds here.
Perfect. So I was told to take no more than 12 minutes. I'll try to be respectful of the other speakers and we'll hopefully get out of here on time. I'm Don McMorran, Director WSU Skagit County Extension, and a fourth generation farm kid from right here in my home county of Skagit County. And it's been a really interesting trajectory. Growing up on a farm, I learned all sorts of really practical information and aligning myself to be an extension faculty member with WSU. And so kind of fast forwarding through that process, next slide, thinking about various stressors that I've personally undergone as a farm producer in the valley, and then seeing suicide happen in my county and wanting to get involved. Next slide. So through that process, we started with a state grant, and then we're able to apply for and receive funding from USDA FRSAN. And through this program, we work with farmers and ranchers and agricultural professionals to share resources about stress and mental health. We conduct trainings and reduce farm stress in agricultural communities. Next slide. Our region happens to be the largest region within FARSAN. We cover 13 states and 4 territories. I personally have visited every one of these states and every one of the territories, and I can tell you that agriculture in this region is very diverse, from very large farms and ranches on the mainland, and then more subsistence based as you get out to the Pacific Islands. Next slide. So through this partnership, we were able to pick up some amazing folks to join us. So we have partners like Rocky Mountain Farmers Union, Farm Aid, AgriSafe, National AgrAbility, Washington State University, UC Davis, Montana State University, Colorado State University, Utah State University, University of Guam, University of Idaho Extension, University of Hawaii, University of Arizona, University of Nevada, University of Wyoming, and the University of Alaska Fairbanks. And what I can tell you through this process is Maddie and myself have a really good understanding about farm stress and suicide prevention in a local area, but having these partners with roots in the ground in their local communities really help make RASUP strong. Next slide. So with these partners, we have some great services. We're partnered with Farm Aid, and they have a farmer hotline resource. And that particular program might sound familiar to you in that Willie Nelson created Farm Aid back in the 1980s during the last major farm crisis. And so they're fabulous about getting resources available to farmers in the United States. And then on the crisis side of things, we've partnered with AgriSafe, and they offer a 24-hour, 7-day-a-week hotline. And they're also a really great resource when you have farmers and farm workers that are in crisis. In the middle column, I encourage you all to visit our website at farmstress.us. We have a clearinghouse of resources that are available. You can click on the online map and it will bring up resources right to you in your local community. Also encourage you, if you live within the West, we do have a mini grant process. So if you're interested in creating professional development, you want to have materials translated, or you want to do outreach in regards to farm stress suicide prevention in your local community, please sign up for those mini grants. There's $5,000 available, and in the past, we've done some really great work throughout the Western United States, and we want to keep this going. Next slide. So now I get to turn it over to Maddie Vanderkoy. Maddie grew up on a dairy farm here in Skagit County. She also has a psychology background, so she's been a great addition to this team. She's going to tell you more about some of our outreach materials. Maddie?
Yeah, thanks, Don. Hi, everyone. Like Don said, my name's Maddie Vanderkoy. Grew up on a dairy farm here in Skagit County and kind of grew up watching how stress impacts farmers within our little small county, and that kind of led me to pursue a degree in psychology and then a master's in human services. So I am here. I help coordinate outreach efforts throughout the Western region. I manage our partner relations and then also just help out with general grant inquiries. So happy to be here and speak on our amazing programs today. And specifically, I'm going to talk to you about one of our key programs, which is Pizza for Producers. It's a program that Don created back a few years ago, and then I kind of helped pilot and implement that program throughout the West and mostly in Washington State. Pizza for Producers. It's a community-based mental wellness program, and we implement COMET training, which is changing our mental and emotional trajectory. It's a cognitive behavior therapy-based program that we have been piloting and implementing here in the Western region, and we're pretty excited about it. So why Pizza for Producers? It's kind of an outside of the box idea, and we get quite a few questions on it, but we created and implement this program because we all know our agricultural producers face high levels of stress, and you combat that with feelings of isolation. A lot of these farmers are spread out, and we understand that social connection is a proven protective factor that can help support mental health and also resilience. So Pizza for Producers, it creates kind of a low pressure, non-invasive, relationship-centered environment where we can build trust and then increase engagement. I will say we just got done last week. We had one of our biggest and I think most successful events. We had over 160 dairy producers down in a neighboring county of ours come together and enjoy pizza. And it created a lot of really good conversations about the importance of social connectedness, and as well as getting people to open up and share about mental health and maybe some struggles and also protective factors that they've used in the past. So it's kind of a good way, and pizza's a good vessel to get people to talk and kind of connect with each other. So it was a really cool event. Throughout the program, for program impact, we know it strengthens social networks, it reduces isolation and fosters peer support. And also another thing is that it serves as a gateway to deeper extension education. So we're able to give out resources for stress management, suicide prevention, and resource connection, and then also supporting long-term community resilience. We also pair these with regional resources. So I mentioned COMET. That's our most common one that we've paired Pizza for Producers with. So what that looks like is we'll either offer a training beforehand and then have dinner afterwards, or sometimes we really let the person who's putting on the event tailor it to what the needs of that population is. So you can sprinkle it throughout the event as well, but we also have partnered with Colorado State University with their land logic model training, and then QPR, which is question, persuade, refer. And then we also give out resources to our 2 call center hotlines and resource lines, so AgriSafe and Farm Aid. I won't go too into detail for the sake of time for program data and evaluation, but you can see through our 2025 evaluation, you can see most of the comments are about the pizza, which is awesome because I am the head pizza chef, so that's good to know. But also you can see that a lot of the comments are about building community and that social interaction that people are gaining through Pizza for Producers. So it's pretty encouraging. We're having a lot of fun with the program, and the farmers are really appreciative of it. So we are looking forward to continuing this program in the future. I do want to let you all know as we wrap up our presentation, right after this, we have our Ag Networking Series. So that's another feature that RASIP offers. It's a open to the public virtual seminar. It's right after this one at 1 p.m. Pacific Standard Time. And we're actually going to have Dr. Maud Powell. She's going to be presenting on her cultivating resilience and ecological distress work that she's doing through Oregon State University. So if you have the time, I really recommend to hop on there and you can learn a little bit more in depth about the work we're doing at RASIP in the Western region. And I will pop that link in the chat for anybody who's interested. And if there are any questions in the chat, that concludes Dawn and I's presentation. So I'm going to stop sharing my screen and hand it over.
Thanks, Maddie.
Okay, thank you, Dawn and Maddie. Appreciate that. Currently, we don't have questions in the chat, but we'll continue to collect those throughout the session and let you know after we finish our presentations. Okay, at this point, I'm going to turn things over to Laura Delpret. Oops, I'm sorry. Did I get the order wrong?
No, I'm next.
Okay, you're next.
Yep.
Okay,
So
great.
just give me 1 second.
No problem.
I'm going to get on started. So hang on.
Okay.
Make sure I share my right screen. All right. Excellent. Can you all see the green screen info?
Looks like it's coming up. There we go.
All right, great. So my name is Laura Delpret. I'm with FRSAN Northeast. We are a relatively small team. It is myself. I have about 20 years in nonprofit. A good 8 of that is in mental health. Was with NAMI, New Jersey. And I originally got connected to this work because I was working in food insecurity during the pandemic, and I had the opportunity to spend funds directly to farmers in New York that were funds connected to the pandemic. So I engaged with a huge amount of mushroom farmers and local farmers during the pandemic. And this type of role really dovetailed so nicely in my passion around food insecurity and mental health. I'm currently pursuing a master's degree in curriculum building and instruction with the focus of adult education, which is right in line with the work that I'm doing here with young farmers. And I've been with young farmers for just under a year and a half. I'm very lucky to have Michi Lopez as the Cultivamos manager. She co-managed a 5-acre farm in Iowa for a number of years before joining Young Farmers, and she oversees our cohort program, which I'll talk about in just a minute, as well as proposal development. And she also does a lot of work around language justice, ensuring that resources, tools, and trainings are available in English and Spanish. And we are a small team, and we have the privilege of hosting the program through National Young Farmers. And together we help coordinate a network of really incredible partner organizations that are working all towards that same goal of strengthening the well-being and resilience of farmers, farm workers, their families, and ag communities that support them. All right, let's see. And, it's really about listening to our partners and communities to ensure that the trainings and offerings that we present are wanted and needed. We work to, make learning very accessible, practical, not time restrictive, right? And that's why we're expanding peer-to-peer learning opportunities to empower people to not only be participants, but become trainers themselves, to be able to share the knowledge. And here is a little bit about, we've been lucky enough to receive funding like others through USDA NIFA program. We oversee a larger umbrella program, which I'll talk about in just a minute, where we're managing training coordination, vetting, connecting, and making sure that we're sharing resources all throughout the Northeast. So what kind of trainings? And you'll hear some of them right throughout the different regions. Mental health first aid. We just recently did, and we'll be doing another grief and loss training, understanding conflict, CALM, which is counseling on access to lethal means. And then we've been working and will continue to be working with partners like the American Foundation on Suicide Prevention, probably NAMI National, Safe Place Therapy, New Jersey Department of Human Services, and many more. And the goal is simple, but incredibly important. It's about connecting farmers and their families to resources that they need before the stress becomes a crisis. Agriculture is rewarding, but it can be very isolating and stressful. So our work is really about making resources accessible, culturally relevant, and easy to find. No one organization can do this alone, which is why throughout the presentations, you'll hear about all these amazing partnerships to help with cross-pollination of these types of opportunities. So at Young Farmers, we're also known as Cultivamos, which means to cultivate. And we have a couple of different components. We have our advisory team, which is 6 partners supporting partner nonprofits. We have our cohorts, which are hyper-local projects throughout the Northeast. There's 18 of those. We have our farmer advisory board, which is made up of 10 local farmers. And then we have our folks that maybe they're not that engaged in a virtual sense, but they want to know about our resources. They want to engage in our Google group, participate in our quarterly call. And we have our info recipients. And then the network is all of us. So who are some of our key partners? We have FarmAid, Farm First, Migrant Clinician Network, Terra Viva, and the University of Delaware. We serve over 150 individuals through about 80 organizations throughout the network. So a little bit about FarmAid, and a lot of folks do know FarmAid because of the concert, right? Everyone knows Willie Nelson, but FarmAid has such rich resources. In addition to their hotline, they also have their Farmers Resource Network, FRN, Farmers Resource, I think it's network. And it's just this plethora of resources for people to engage in. And they play this role of helping farmers all across the region, all throughout the year. It's not just a concert. And they also collect valuable data that helps identify what farmers need support, ensuring that resources continue to evolve as the needs evolve. And a lot of times they're often the first contact for farmers seeking help. And they really play an essential role in connecting people to trusted information and resources. We have MCN, Migrant Clinician Network, and they are an organization that works to culturally expand appropriate services. They make their resources as available as possible in English, Spanish, and Haitian Creole, helping agricultural communities receive information that they use every single day. And this helps remove barriers to care. We have Farm First. Farm First, I apologize. Farm First actually trains clinicians about ag, helping them understand the unique stressors around farm life and farm work while developing counseling that works specifically for farmers. You know, it's one thing to have counselors available, it's another to have counselors who know and understand agriculture. Terra Viva is a worker-led organization, so they are very worker-forward. They help create local networks where people in ag can connect with each other. They focus on building trusted relationships, community-led solutions, and they do a lot of work through peer mentoring, community wellness gathering, and mental health education. And then last but not least is our extension connection, which is University of Delaware. They are a very trusted resource for bringing education and training directly to farming communities. UDEL helps ensure valuable information, practical training, and education resources reach the ag communities that they're designed to serve. They've always been a trusted resource, and we're so happy to continue to work with them. We do have 18 cohorts, and I will not go through them all, but they all do amazing work. These are groups of folks, farmers, farm workers, and service providers who identify needs in their community and then create projects that we fund through that. Each project receives $10,000, and they're all different, which is so interesting that you have so many people having so many interesting ideas like popcorn. So the beginning farmer land access cohort, they do monthly lunch and learns, and it runs the gamut, right? It can be about finances, because if you know anything, your finances will affect your mental health, cooperative models, and they do this every single month. You can guarantee that there's going to be a workshop happening, and it's free. The ag support cohort, they are very focused around veteran farmer mental health and realizing that, yes, there are these resources, but has analysis been done on the work? So this cohort focuses on that analysis to ensure that farmer veterans are getting targeted mental health support from ag service providers. And then the extension cohort, UDEL, they have a peer-to-peer initiative, farm and family finance, ambiguous loss training. I found a typo. And my favorite is the confidence conversation curriculum, which is about modeling conversations between service providers and farmers to have the hard conversations in a way that is helpful and productive. Our FAB is another small but mighty team. It is made up of 10 farmers, farm workers, and ranchers in the Northeast. And they are there to ensure that the voices remain central to decisions around training opportunities, service groups, and even other organizations can meet with the FAB to pilot trainings and get honest feedback from the folks that they're creating trainings for. We talked a little bit about our info and resource recipients. If you want to join our Google group, you're welcome to just send me an email. It's super simple, laura@youngfarmers.org. In that Google group, you'll see things like training opportunities, workshops. I'm a big grant person, so I'll put up grants that are available or scholarships that are available to folks in ag. Sometimes there are job opportunities. Sometimes people are just troubleshooting things going on at their farm. You're welcome to join. You do not have to be in the Northeast to participate, and you can be anywhere in the world to participate in our trainings. You do not have to be in the Northeast. And then the main point is supporting farm workers and farmers with clear professional development, making sure that their voices are heard in conversations. It's not just about agencies creating and then saying, this is what you need. It's about taking the voices of the folks that we're engaging with and implementing them and having them be heard in those tools and workshops. And then agencies in turn get to have valuable insight with lived experience and then improving the quality of what they're providing to producers. The Northeast agriculture community is incredibly resilient, but resiliency does not mean that you have to face challenges alone. And through FRSAN and the partnerships, we've built a strong network that makes mental health resources, trusted connections more accessible to folks in ag across the region. And we're really proud about the work that we bring and what we do. And we're excited to continue to keep doing this. And one thing that I've always hoped that people remember, it is such an important message that asking for help is not a handout. It is a hand up. And that is what we're here for. We want folks to engage with us. We want to provide that hand up. And I'd be glad to take any questions that anyone may have.
Thanks very much, Laura. Appreciate that information, and we'll continue to collect questions through chat. Feel free to enter those at any point. At this point, we're going to change, move on to Susan Jakes with the Southern FRSAN.
Thank you so much, Laura, Don, and Maddie. It's so inspirational to hear what you all are doing. We're just starting out in the South, so it's really wonderful to hear what the other regions are doing. It's just amazing what can be built over so many years. So we started this in December of 2025 is when our funding was released. So we are excited to tell you about the kind of upstarting new network and what we've been able to accomplish in that short time. Next slide. So we have 4 goals in this first year of FRSAN South. These are going to change in the coming years, but to get us up and started, we wanted to kind of establish a regionally representative network. We want to develop a clearinghouse, and we're just getting started on that, of farmer assistance programs across the region. We want to educate people about FRSAN, FRSAN South, our activities, existing resources and programs, and I'll share some of those with you today, and provide a range of services, including preventative care activities. So this is our team that we have built here in North Carolina. There are 3 PIs for this project. I'm Susan Jakes. Yes, we're going to share a regional program in a second. Sorry, I saw the chat. I'm Susan Jakes. I lead community and rural development for NC State Extension, and I'm a psychologist by training. We also have Dr. Shankar and Dr. Schulman. And then we have kind of developed an infrastructure to run this program. And it's been really exciting to be part of this team because it is so high functioning and they get so much work done. It's incredible because as a PI on this project, I give 20% to it, but these people work, half to full time, and it's amazing to see what they do. So let's share a little of that. So this is the network we've built. We're still kind of finishing up some subawards, and some are in process, but I think we initiated, 8 at this point, or 9. Sorry, let's go back. So all around the South, and we have every state representative that we're working with, and it's been really exciting. Let's share a little bit about what we're doing as a whole, and then about what some of the states are doing. Okay, As a network, this is kind of how we're functioning a little bit. I'm sorry, I'm losing my voice. So we offer a monthly newsletter called the Partner Huddle. We have work group check-ins and we have a monthly partner meeting. So all those partners that you saw on the previous slide will join a partner meeting. And we've also been busy kind of going around the country, exhibiting, handing out marketing materials, building our website and building our social media presence. And so this is some of the work. We've had articles written about us. And I think it's really exciting. Our philosophy has been kind of just, you know, start with bare bones, but get things up as quickly as possible to recreate a presence in the South because we've heard over and over from our partners. It's just like FRSAN South. It's really important to send farmers to a reliable place to go so that when we advertise a resource, they know that resource is going to be there and it's going to be there ready to help. So that's really important to kind of reestablishing that trust. Okay, next. Another big project we're really excited about for our partners is we're going to bring everyone together September 22nd through 23rd in Charlotte, North Carolina for a regional convening. I just wanted to share at this convening, this will be open to our partners. We're going to have a panel about farm family ownership stories with Dr. Rich Bonanno, Vicki Porter of Porter Family Farms here in North Carolina, and Dr. Robin Tudor, who is the retired director of the AgrAbility Institute here in North Carolina, and now she works with the Veterans Farm of North Carolina. We're also busy kind of expanding the network, as we saw in one of the early slides, supporting the partners to do the work they want to do, and really working always to rebuild trust through connection and collaboration. So I wanted to just highlight what some of our partners are doing. These are the things available to farm. The partners really work on two levels. So this is more focused on what's available for farmers, but they're also working on the system within their states to make the mental health services and other, agriculture services more effective in mental health and in farming communities. So teaching agricultural support services about things like QPR and CALM that you've heard, and mental health first aid, that sort of thing. And then also working with the mental health community to make them more ag knowledgeable, as you've heard about in the Northeast. We do that same sort of work. Our states do that same sort of work. And then also these programs available directly to farmers. So I just wanted to highlight 3 states, have 4 states here really, but that North Carolina Agri-Medicine Institute has some amazing programs. If you just Google North Carolina Agri-Medicine and their Stress Assistance Network, this is the North Carolina Focus Network. So we're partnering with people in every state, including North Carolina, so we don't lead the work in North Carolina. And Paul is going to send out after this presentation. This presentation has in the notes section are all these links, and so you can access any of these things. So they have a farmer-to-farmer peer support program that is really amazing. Women in agriculture, so it's a kind of a support program for women working in agriculture so they can build support groups and support each other through their work. We know that in farm stress, that most of the times we hear from the support people to the farmer and not necessarily the farmer itself. So you might hear more from the families first. And so having connections with those families, but also providing support for the women that are working on the farm. And then free counseling service. They have a voucher program that provides free counseling. So you can get vouchers through the North Carolina Agri-Medicine Institute. In Mississippi State, if you haven't seen the On the Farm documentary, it's an amazing watch. So kind of it's heartbreaking, but also hopeful. And the Promise Initiative, where they're preventing opioid misuse in the Southeast. both of the links of these programs are there. And, you know, if you want something to do this evening, you and your family can watch On the Farm documentary. It's just so inspirational to hear the stories and, you know, what people have lost, but also the hope that they have in farming. And the last I want to talk about is Virginia. They're trying to expand their work in the farm dinner theater. I couldn't mention farm dinner theater without mentioning University of Kentucky, who is really the pioneer in developing a lot of the work. So these links will take you one to a video about farm dinner theater that's mostly featuring people from North Carolina Agri-Medicine Institute. And then it will take you to the Rural Health Information Hub, which has lots of resources about farm dinner theater. And then that toolkit itself that was developed at University of Kentucky, which is amazing. And they have all the scripts, and then they have videos showing the different theater productions and kind of hands-on how-tos to, you know, what you need for props, which is not much, how you recruit your actors, which is pretty easy because it's just scripts that are read. But in the first link, Robin Tudor tells a really inspiring story about, you know, this is a simple thing, and she didn't understand it really until she saw it in action. And it just sparked a conversation like no conversation she'd ever had. So it's an easy way to get really deep conversations going and introduce deep topics. So that's really exciting. And lastly, here is my contact information. And it's so exciting to be talking with you all, and we are really happy to lead this network in the South. Thanks, Paul.
Thank you, Susan. Okay, we have one more presentation. This is from the North Central region, and we got Casey Hulshoff. Again, if you have questions, feel free to put those in the chat. Turn things over to Casey.
Thanks, Paul. Sorry, I know I'm still getting my video up here. It was like Susan said, it's been great to hear everyone's different areas. So my name is Casey Hulshoff. I am the Mental Health Voucher Program Coordinator here in Illinois. In addition to that, I'm also a provisionally licensed mental health counselor. So I get to do two of the things that I love the most. I'm going to dive into the North Central Farm and Ranch Stress Assistance Center. And before I do that, I want to acknowledge the grant that makes this all possible. And later on, I'm going to kind of dive into the different voucher programs across our region. And so a big shout out to Karen in Missouri, Sean in North Dakota, and Andrea in South Dakota. We essentially compiled all of our information together to create this research and manuscript to tell more about the voucher programs across our region. So a little background. Across the North Central region, we have lots and lots of resources and programs, and all of those can be found on our website, thefarmstress.org. And so you can even break it down by like your state or what assistance you need. So it's a wonderful website. So I highly encourage anyone who's interested to go check it out. But like I said, we do training programs, like a lot of those that have already been mentioned, but like mental health, first aid for adults and for youth, weathering the storm, lots of different programs. There's helplines, support groups. Again, what I want to kind of focus on today is the behavioral health services that we offer. And so when kind of looking at all of this, we were like, for those in the industry, we know that, farmers experience those unique occupational stressors. Like, how do we help them out? And so it's really important to us that we kind of give that background information, for those stressors. It may be uncontrollable environmental factors, financial volatility, but those ties to the land and so much more. And so when farmers and ranchers have that, they also they have study shows that they experience mental health mental health issues such as, sorry, they have a poor mental health outcome compared to the general population. One study showed that 1 in 8 producers met the clinical threshold for depression and anxiety, and 1 in 5 met the criteria for generalized anxiety disorder. So hearing that, we say, okay, with knowing that, what barriers are in place? And so when we break it down, there's 3 different barriers. There's the attitudinal, which is they're not convinced anyone could help. The instrumental, having no one who could help me get professional care, or the stigma related that I think a lot in our industry are aware of, and kind of fall back on of like, oh, it's, the stigma barrier, but it's just that idea of being judged for needing services. And so we saw in a study that there was 75 respondents were open to receiving information, but it's how to get that information to them. They weren't not always willing to seek it out. So we're like, how do we put ourselves in those areas where farmers already are? And so with the voucher program, excuse me, in our region, there's 5 different, there's Illinois, Michigan, Missouri, North Dakota, and South Dakota that use FRSAN money and funding to provide free services to ag producers. And so the program approach includes using vouchers to redeem redemption with partnering providers, accepting requests, and referring to within organization clinics and contracting with behavioral health clinic systems. We took that in the 4 states. We combined project directors and coordinators to identify components that were working and also to identify challenges that arose. So how do we create voucher programs and kind of set a guideline or like well practices across the 4 different states' experiences? And we realized too, like no programs, 2 programs look alike, but how do we use these past experiences to help those in the future? So breakdown of Illinois, and this is often the case in many of the programs, but for eligibility, there is a requirement. In Illinois, you have to be from the state, you have to be involved in the ag industry, whether that's direct as a farmer, a worker, a family member, or those in the ag industry. When we were creating our program, we wanted to put the power with the producer. So we went across the state and found 120 partnering providers, and we add to that consistently. So if anyone is interested, they can become a partnering provider. Those providers come across 39 different counties in the state, and within those providers, 3 of which are bilingual. And so the provider can find information online or through any of our marketing we've done. Go online, fill out, it's a completely confidential form. They receive vouchers and they receive the provider directory. So they, again, have that power to pick the provider that they feel like they would connect to the best. They receive 3 vouchers to be utilized with the provider that they picked. And they can go on, in that directory, it's their website, provider information, so they can set up their first initial visits. Another really cool thing that we do is we have the provider ag literacy training. So providers can go through the training, receive CEUs, and become more well-versed in the ag industry. And again, this is just a comparison amongst the 4 states, Illinois, Missouri, North Dakota, and South Dakota that we compared. And you can see the criteria to become for the producers, how each state partners with the services and how many numbers of sessions they receive. I think the really cool part here is across the 4 states that 3,000 hours of service have been provided. And so it's going to show that when we put our services together, how much we can accomplish. This is just kind of a breakdown of costs. in total, there's no cost to producers, and I think that's an important thing. Different states, some will do like a sliding scale, some might bill insurance, but at the end, there's no cost to producers or their families. We've noticed some challenges throughout the program. Essentially, it's when starting the programs, we wanted to ensure that HIPAA and confidentiality was in place, and so that doesn't leave, like most research, you get a lot of information, and so potentially a recommendation for that would be building evaluation in the program in the beginning, but still holding confidentiality and HIPAA at the utmost importance. We found that it was hard to determine demand, and so working with extension or working with providers would be a good way to communicate those challenges and those recommendations. But we wanted to ensure as well that we allowed for the clients to feel safe and secure when going through these programs. When it comes to serving diverse ag populations, there were some challenges we noticed. Traditional programming and marketing was, not able to capture anyone and everyone engaged in agriculture. And so a recommendation would be to partner with providers that offer services in clientele's preferred language and modality, and then, of course, ensure cultural competency training throughout. One example of this for Illinois, we partnered with Great Lakes Center for Farm Workers' Health and Wellbeing to promote the program to farm workers, and that's been a really good partnership of ours. And of course, with community trust and participation, there's challenges that arose, the stigma that we have mentioned before, and just noticing that producers are reluctant to seek out health services and a trust in providers. So, of course, recommendation would be partnering with clinicians who have an ag background, and again, offering and really promoting the ag literacy training, and that is available to all of the states who are involved in this in our region. And every time I talk to a provider who's finished the program, they're like, "Wow, I didn't realize how much there was to know about this specific clientele." So it's good to kind of hear those things after the training, that we're being able to bring the farm to the providers. So, and of course, with most programs, there's some challenges that come with awareness. And so noticing that the awareness was low, but also remembering that utilization takes time. And so, of course, marketing and advertising and, doing different radio advertising, publicizing conferences, that's been helping. But the most, I would say maybe successful has been like boots on the ground. Word of mouth has been huge for us as well. And of course, utilizing extension offices would be helpful in this situation. So in conclusion, there's a large need for agriculture-specific behavioral health services, and each state has done their own system to work towards reducing care. And of course, there's going to be challenges, but at the end of the day, it's worth it. I love hearing this quote. We heard it at a conference, at a booth. Someone came up and said, "I tell all my friends and neighbors about this program. I can't recommend it enough. The voucher saved my marriage and maybe my farm." And I think at the end of the day, that's why we're all here. Thank you for this time. Like I said, here's the farmstress.org website for any questions you may have, and my email, and so is Josie's at the end if you'd love to hear from anyone. Thank you.
Well, thank you, Casey, and thank you to all of our presenters today. We do have a few minutes left in our hour for questions, and at this point, we've only been able to share an overview. I've kind of scratched the surface, and there were a couple questions, related to specific state resources, and I guess the question would be, for people that are out there, maybe have a need, or maybe they're service providers, what would be the next step? For example, we had a couple states questions about Minnesota, Iowa. Where would you look to find out, what specific resources are available for you in whatever state you're living in. And I open that up to any of our presenters to respond to. I know there was a website from the North Central Center listed there, and that's looks like they've got a directory online. But how about the other areas?
Yeah, Paul, I can go ahead and throw in for the West. We do have a clearinghouse that has a map on the farmstress.us website. So you can just click on your state and it will provide all the resources available to you in the West. And Maddie's posted that. Thank you, Maddie.
Okay, thank you.
So right now in the South, we have our states individually have a lot of the resources pointing on the websites, but we're still forming the availability of the clearinghouse on the FRSAN South website.
Okay, great. Thank you. Another question. Several regions presented voucher programs. Please share how mental health parity laws in states impact vouchers. If farmers already have coverage for mental health with their insurance, why tap into a voucher which is resource limited? And that's far beyond my ability to make any response to. So I'll open it up to everybody else.
Again, I'll go ahead and throw in. So for the Western region, what we've talked about is we want a door available for anyone who comes to us so that they can open it. So whether that's a voucher, whether that's going the extra mile and getting them lines that they can call, if that's a resource line, a crisis line, or even now in our RASP 6 proposal, we're actually talking about partnering with a behavioral health institute and getting folks intensive outpatient work. And so I think, for us, I understand your concerns. Yes, if you have insurance, that's great. You would be asked to use your insurance prior to moving forward with a free service through RASP, but we want to have something available for everyone.
Okay. Any other comments on that?
I would say the only other thing I've noticed too is yes, those may or may not have insurance, but also I think it's too related to that. Like, I don't want other people to know I'm applying for vouchers or I need counseling, and so kind of see it as a way of like getting help without having to go through insurance and the paperwork that's included with that.
Okay, thank you. Another comment in the chat, and we appreciate your comments and questions. In the Northeast region, our extension cohort developed a resource fact sheet for each of the 12 states and Washington, D.C., and a version that has also been translated into Spanish. So appreciate knowing about that resource out there, which kind of brings up another question point. I know, when you're dealing with potentially every agricultural producer in the entire United States, all the way from the Pacific Islands to Maine. It's quite a diverse group, and I know, Don, when I've been on some of your calls, you talked about all the different languages you had to deal with, potentially for translating, and Laura shared several resources that they've been working on translating too, and how do you deal with the diversity of audiences that you're facing?
Yeah, we just try to do our very best. In the past, we've had staff on board to do translation. Unfortunately, some of those people aren't with us, but we are considering including those in our next application. And then just, trying to be inclusive as much as we can as the need arises. We have funds made available specifically for translation, specifically in the mini grant process. So that's been a really great tool because, there's always corners you can't see around it when you're applying for grants. So having some funding available set aside so that when problems arise, we can step in and meet those needs has been very important to us.
Okay. Any other comments on that?
I can make a comment if that's okay.
Sure.
To echo that, what Don said about the mini grant funding, the West, we just got back from Micronesia, Chuuk, Micronesia for a farmer focus conference a few weeks ago. And down in Micronesia, each island has their own individual language. So I think something cool that RASIP does is we meet these people where they're at, and then we've engaged extension staff in each of these island territories. And then they're able to provide those translation services as well. So we've strategically aligned ourselves to help address, because there are a lot of different spoken languages. I know throughout the United States, but in the Western region, it's quite diverse. So we try our best to accommodate all those people.
Yeah, it's a good point about extension as a resource. I mean, they're on the ground in their own communities, and assuming they would know the languages too. So that's a good point. Any other comments on that before we move on? Okay, another question. How specifically, what do you use to inform farmers of these resources? Are you going out in person within your regions, for example, at county fairs? And Laura did respond in the Northeast. They share on their social media, listservs, Google Groups, newsletters, and through partners working in the Northeast. How about some of the other regions? What kinds of outreach methods?
Yeah, so Skagit County Fair is next week, and Maddie and I will be there, and we'll be having our materials out. But we've done everything under the sun. We've done huge marketing campaigns. We have social media, we have our websites, and then I think the biggest component, at least for RASIP, is our partners. So we have a partner in every state and every territory in the West. So we really lean on them to help spread the word about our programming and align us with the farmers and farm workers in their area.
So we're
I'll add-
structured, I'm sorry about
Go
No,
ahead.
you're okay.
We're structured a lot like RASUP in terms of our partners. Our partners are really the local experts. And so we've done a lot of regional and national, kind of getting the word out. We have a regional presence, but in the partners, we always point anybody in the states that's asking a question to their lead partner organization in their state, because we want them to be the face and the expert of local farm stress work.
Okay, thank you.
Yeah, same. We have a wonderful outreach individual who goes to all across the state. Lots of marketing campaigns. We've done the radio ads, but as everyone said, our partners. And again, the boots on the ground, the word of mouth, I think has been our biggest component and biggest success rate, actually.
Okay, great. And Laura added also they do large conferences, farm aid, disability ag, and partner. She says partners are the real key in reaching the communities there. So we are at 4:01 my time, a little bit over the hour. Thank you for everybody that's participated. And I will mention we've got one more webinar in this series scheduled at this point, Wednesday, August 26th at 3 p.m. Eastern. Dr. Remington Rice from Michigan State University Extension is going to be talking about their revised farm stress training programs and facilitator guides. So we'll plan to send out a message about that. Please feel free to join us, and thank you to all our presenters today. Thank you for our participants. Please remember to give us a minute and fill out your evaluation when that pops up. And with that, we'll say thank you again and wish you all a good day.